to the release of the Braino puzzle. I'm Renee Marks and I am presently in my therapy room at Integrate Families, which is the National Centre for Child Trauma and Dissociation in England. As part of my training, I have developed and now releasing the Braino puzzle. I start with the children when I use this puzzle to ask them to build the puzzle. And then I explain to them in a very, very elementary way about this puzzle. In the first place, we've got the brain stem responsible for emotional regulation, and that is the fight responses, the kicking, the biting, the hitting, the hurting, spitting, running away, high levels of anxiety, and sometimes just freezing. And then we've got the cerebellum, mainly responsible for movement, the limbic system responsible for attachment, and then we have this big white part, which the children prefer to call this part of the brain, which is the cerebral cortex. Now, I explain to the children that when they start to kick or hurt or become emotional dysregulated, what actually happens is that because this white part of the brain is not very strong, what happens is it is actually flying away. And then when this flies away, there is no boss in the brain. There is nobody that can actually say to the brainstem, stop that behavior. So what we need to do is that the child needs to do exercises on a daily basis with the parents in order to help this part of the brain, the thinking brain, to become stronger. And as children do that again and again, they actually start to realize that they have more control and also provide subjective experiences to this effect. When this part of the brain becomes stronger, we see that the children have the feeling that they can now regulate the lower part of the brain and that they can actually inhibit the impulses of the lower part of the brain. And that is really what we want. We don't want children to feel ashamed or shamed because they can't control their behavior. In essence, I want the children that I work with to develop an internal sense of self-control over their behavior by using neurobiological principles. I trust that this Braino puzzle will really help you as a therapeutic tool in your work with children. It shifts the concept for the child and the parents away from behavior modification to understanding about the importance of the neurobiology when children were traumatized. And it's taking the pressure off children to try and behave and try to avoid sanctions in their life and try to be good, to a place where the child is starting to focus on doing regular activities in order to feel internally that they have control over their bodies and over their behaviors.